Following portion of Daytime Tri-Cities is sponsored by Hometown Medicare Advisors.
While the clock is ticking, this is crunch time for millions of Americans looking at Medicare and health insurance coverage. The annual enrollment period is underway, and now is the time to be looking at your options. This morning, Andrew Price with Hometown Medicare Advisors is back with us as we get Medicare educated. And today we're talking about what people need to know about health insurance for 2022. And it's great to see you again.
I'm glad to be back.
It is definitely that time where those enrollment periods have been going on and they're getting ready to shut down, so now's the time to really be thinking about it.
Yeah, we're getting on the tail end of the Medicare enrollment.
So what changes, that's where we're going to start, what changes is Medicare making for 2022?
So Medicare made a few announcements a couple weeks on some of the rates that are going up. One that everyone's really concerned about is the Part B premium. That's what people actually pay for their Medicare, and it's actually going up a decent amount. It's going from $148.50 and it's going up to $170.10, and that automatically comes out of people's Social Security check, and that takes effect on January 1st. Okay. And then the Part B deductibles and the Part A deductibles are also going up quite a bit.
And we have those numbers for those increases as well. That Part B dedicated deductible increase is about $203 was, and now it's going up to $233?
To $233, and then the Part A deductible is going up to $1,556. A lot of people don't pay those deductibles because their supplements or their Advantage plans cover those. But if you just had Medicare A and B, or if you have a Medicare supplement that doesn't cover the deductibles, that's when people would have to pay those.
Okay. And then what about the drug plans? What are we seeing when it comes to those prices?
So the drug plans change every year, so it's always very smart to review your drug plan to see if your drug is covered and what the co-pays are going to be for January. What people will actually notice the most is the deductibles going up. So if you have a drug plan that's all by itself, if it's not built into your Advantage plan, then the deductible is going up to $480 here in January.
So that's good to know. And you also have some donut hole levels that we wanted to show people, and those are, we hear that a lot, that phrase, the donut hole.
Correct. A lot of people don't hit the donut hole, but it's the people that do that have a really hard time with it. The donut hole shifts every year. So the amount to get in the donut hole goes up a little bit, which means you don't hit the donut hole as soon. But then also, because of that, to get out of the donut hole, those levels go up as well.
And some of the dates that we want to make sure people are aware of, and we have some of those deadlines when it comes to making any changes.
Yes, so December 7th is the deadline for Medicare. So you just have to make sure that you've chosen to if you're going to change your Medicare plan, December 7th is the last to do that. And any changes you make start on January 1st. Now, we also have the health insurance. If you're not on Medicare and you just need health insurance, that enrollment period is actually going on right now as well. And that actually has been extended to January 15th, so you have a little bit of an extension to figure out your health insurance.
And of course, health insurance is pretty expensive, but there are some options that people have.
Yeah, so a lot of people don't know that you can get a tax credit to qualify to get assistance on your drug premiums. So a lot of people, as long as you're not offered insurance through an employer, can get a tax credit to help you buy your insurance. And I made a little graphic there to show you some different income levels where you can actually get all of your health insurance premiums paid for. So if you don't have health insurance, you can contact me and I can look at your income, and based on your household, you can qualify to get a tax credit. Now, in all cases, it won't always cover everything, but you'll be surprised on how affordable the health insurance can be if you can get that tax credit.
All right, well, certainly a lot of information. Want to let everybody know you're at the Walmart on Browns Mill Road, Mondays, Wednesdays, and Fridays, 8:30 to 12:30, right?
Right. I'll be a little late today because I was on the show, but I'll be there till about 3 o'clock today. But I'll be there today, and then Wednesday and Friday, and then my last day is Monday because the Medicare enrollment is ending. Okay. But I do have an office here in Johnson City.
All right, and that phone number is right there on your screen as well. If you would like to get a hold of Andrew, you can find him at 423-737-1865, Hometown Medicare Advisors. Great to see you.
Thank you.
The preceding portion of Daytime Tri-Cities was sponsored by Hometown Medicare Advisors.